acknowledging that mistakes were made and informing me that Customs and Border Patrol would be doubling staff at O'Hare Airport today. I continue to monitor this situation closely. I don't usually get heated on Twitter, and I always try to work through official channels when possible. But when I saw hundreds of people crammed together for many hours at O'Hare in exactly the conditions that I have been warning about for days, I was furious. There has been nothing here having anything to do with politics. Frankly, cooperation between Democratic and Republican stakeholders and officials around the state of Illinois over the last week has been incredible. My anger had everything to do with protecting the health and safety of the people of our state. If getting mad on Twitter is what it takes to get federal officials to act, then I am absolutely going to do that. As I've said, there are no easy decisions left to make as we address this unprecedented crisis. Every choice that we face, every choice now, is hard, and it comes with real consequences for our residents. But as your governor, I cannot let the gravity of these choices prevent us from taking the actions that the science and the experts say will keep people safe. With that said, I am ordering all bars and restaurants in the state of Illinois to close to the public as of the close of business Monday night, March 16th, through March 30th. We are working with restaurant owners and food delivery services across the state to see if restaurants can safely keep their kitchens open so the restaurants can continue food delivery to people at their homes. Additionally, we are allowing drive-through and curbside pickup for restaurants to serve the public over this period. We are working with restaurant owners in this effort. Sam Toya from the Restaurant Association is here with us today and has been an incredible help to my administration in troubleshooting this difficult issue. My staff is working around the clock to help resolve all of the logistical concerns around an action this unprecedented, and we will have more details in the days ahead. There's another hard step to take. I know how difficult this will be on small businesses around the state. This is another hard step. But we must do everything that we can to safeguard the health and safety of the citizens of the state of Illinois, and that requires urgent action. I tried earlier this week to appeal to everyone's good judgment to stay home, to avoid bars, not to congregate in crowds. It's unfortunate that many people didn't take that seriously. The time for persuasion and public appeals is over. The time for action is here. This is not a joke. No one is immune to this, and you have an obligation to act in the best interests of all the people of this state. In some ways, my sincerest hope is that when all of this is over, that we hear a whole bunch of complaints that the state overreacted and took action that was too aggressive. That will have meant that we survived all of this with the best possible outcome, saving many people's lives. As I announced last week, starting tomorrow, the James R. Thompson Center will be closed to all people who do not have business with the state. My team of deputy governors is working with each of our agencies to continue to provide critical services while following IDPH guidance on risk reduction. That includes directing some employees to continue to come to the office, moving some to a work-from-home capacity, and making other needed adjustments to work schedules. These measures will roll out over the coming days, and state workers should expect communications from their agency leaders shortly. All employees will continue to be paid during this time period. The Department of Innovation and Technology has been working tirelessly to ensure that our state agencies have the resources that they need to continue state business. Next, I want to take a moment to talk about something that I know is weighing on everyone's minds: food access for our school children, our most vulnerable populations, and all of our residents. I know the grocery stores faced a major surge of shoppers in the last few days, and pictures of barren shelves are quick to circulate on social media. I want people to know that Illinois' food supply chain is among the nation's strongest and steadiest, and I'm committed to keeping it that way as this situation evolves. Already, we conferred with grocers of all sizes throughout the state and asked for their advice on what would make it easier for them to get products through their stores and to our residents. Based on that feedback, my staff and I have connected with municipalities throughout Illinois, including the city of Chicago, asking that they end their prohibitions on overnight grocery deliveries. We've also reached out to the federal level, asking them to change regulations to free up the flow of merchandise from warehouses to stores, and we're working with our own state police to do the same wherever we can. My team at the Department of Agriculture is working around the clock to see how our rural farming communities are doing, how they're faring during this time, and across the board, the answer has been that their supply remains good. We also connected with major national and global food processors, including Archer Daniels Midland, based in Chicago, to check in on their supply chain, and they are doing well with no hiccups. We need the people of Illinois to help us here, too. Please do not hoard food. Buy what you need, but please be reasonable. Think of your friends and your neighbors. There is enough food to go around, but we need people to not be selfish. As for school-provided meals, as I mentioned, our State Board of Education has received the necessary waivers to continue to distribute 2 meals a day to children who qualified for free and reduced lunch statewide starting Tuesday. ISB has been working day and night to set up plans with districts across the state, and local districts will contact students, parents, and guardians directly with more information about what distribution looks like in their communities. Here in Chicago, all school buildings will be available for grab-and-go pickup for breakfast and lunches to any child under 18 between the hours of 9 a.m. and 1 p.m. You don't have to go to your own school, and you don't have to be qualified for free and reduced lunch. CPS is giving food to any child who needs it, no questions asked. And I want to just call for a moment for all of you to recognize the hard work that the mayor has put in with her staff and with CPS to make sure that this has happened for the children of the city of Chicago. That work is going on all across the state. We have 102 counties, cities all over the entire state of Illinois that are working this out locally, and I'm very grateful for their cooperation and their hard work. Additionally, I reached out to the largest food manufacturers in the state, including Kraft Heinz, Conagra, and PepsiCo, and asked that they donate specific critical items to food banks statewide to help provide a third meal to children who get most of their meals during a regular school day. Those manufacturers conveyed a resounding willingness to help. Regarding the food banks themselves, here in Illinois, there are 8 major food banks that serve every one of Illinois' 102 counties. All have existing networks that they are partnering with, and all are members of Feeding America. Additionally, the food banks have a collaborative effort called Feeding Illinois. All 8 are already doing some level of coordinated response in nearly every community. Either they are in conversation with existing faith and community partners or have been contacted by school districts. For more information on food banks or to learn how you can help or contribute at this critical time, go to feedingamerica.org/COVIDIL. That's feedingamerica.org/COVIDIL. Next, I want to address blood donations. Across the state, we've seen an outpouring of individuals fiercely interested in supporting their neighbors as this situation evolves. I want to encourage individuals who are healthy, feeling well, and are eligible to give blood or platelets to make an appointment to donate as soon as possible with the American Red Cross. A blood shortage could impact patients who need surgery, victims of car accidents and other emergencies, or patients suffering from cancer. One of the most important things that you can do to ensure that we don't have another healthcare crisis on top of the coronavirus is to give blood. The Red Cross has procedures in place to enforce social distancing guidelines and keep donors safe as they accept blood donations. They need our help right now. Finally, I want to address concerns about the election on Tuesday. Folks, right now, every decision that I make is between a bad choice and a less bad choice. The only thing that I know is that I can't fail to make a decision at all. That is what I know. I cannot fail to make any decision. If we delayed the election, it is unclear when we might be able to hold another one. Many thousands of people have already voted through the mail or have early voted. Thankfully, Illinois has made the ballot very accessible to our residents. In fact, we have already set a record for the number of mail-in applications in Chicago that have been received. We're working with our local county clerks all across the state and boards of elections to make sure that in-person voting on Tuesday is conducted safely. But remember, today, tomorrow, and Tuesday, all are election days. Democracy must continue. We have to elect leaders even in less than ideal circumstances. None of these decisions I come to lightly, and I work hard to consider all the benefits and consequences of each decision. Over the last week, I've had conversations with Illinoisans asking them to make significant sacrifices for the greater good. People of all stripes, political persuasions, and economic status. I am so proud to tell you that to a person, their responses to these difficult actions that I've laid at their feet has been, I understand, Governor. What can I do to help? It has made me so very proud of the people of our state. These are your neighbors, your friends, your family, your business owners, your elected leaders, your civic associations, your first responders, and your healthcare workers. These are the wonderful people who make this state what it is. I have a reputation as a bit of an irrepressible optimist when it comes to Illinois. The last week has validated every opinion that I've ever held about the people of this great state. Our people are the bravest, kindest, hardest working individuals anywhere in the nation. And I believe in you. I'm going to fight like hell for you in the weeks ahead. As always, we'll be back tomorrow at around 2:30 p.m. unless otherwise noted. Now I'd like to turn it over to our partner in this endeavor, someone that I have spent hours on the phone with over the last several weeks and who's doing a terrific job on the behalf of the people of the city of Chicago. That's Mayor Lori Lightfoot.
Thank you, Governor. And I want to thank the governor for his continued leadership and partnership. And he's right. This is a time of making very tough decisions, all of which are challenging. Let me also acknowledge the other people that are standing behind me. Dr. Nzike, the director of the Illinois Public Health, Dr. Allison Arwady, the commissioner of Department of Public Health, Rosa Escarino, the commissioner of the Department of Business Affairs and Consumer Protection, Sam Toya, the president of the Illinois Restaurant Association, and General Nadeau, who heads up the state's emergency management. I also want to thank Dr. Janice Jackson and the entire CPS leadership team for standing tall in this challenging time. I want to thank the parks led by Superintendent Kelly, and a special thanks to SAU 73 led by President Diane Palmer and all the hardworking parks employees. Thanks also needs to go to Commissioner Andrea Telly of the libraries and the tremendous librarians and staff for their hard work and sacrifice. Look, we all know this situation is evolving rapidly. We are working to respond to what happened at O'Hare last night, and if the governor tweets get their attention, so be it. What I can tell you is that, like the governor, we've had extensive conversations, very blunt and candid conversations with folks at the White House, Homeland Security, to make sure two things. One, that they start to listen to local officials. Mayors and governors, we are all on the front lines of making sure that we're implementing federal directives, and they would be well served to listen to us, bring us along on the journey to make sure that they understand what the consequences of federal directives are going to have on the local level. And the second thing, like the governor, is they have to get more personnel at Customs and Border Patrol. We don't need more ICE members, we need more screeners at the airports. What we have done so far today is entered into a new agreement with DHS to, in effect, deputize members of the Chicago Fire Department as screeners. These are our EMTs who are providing medical care every single day. Those folks are going to be joining the other screeners at O'Hare Airport to limit the crush of passengers that are coming in. We've also called upon the FAA to allow passengers to remain on the planes rather than queue up in the congressways, so we avoid seeing the congregations of people that we saw last night. These efforts are already in effect, and I must thank Jamie Rhee, our library commissioner, for her leadership and work on this. We are also working to make sure that we do everything that we can to flatten the curve and mitigate the transmission of this virus. Our efforts, both at the city, county, and state level, are rooted in science and data. It's bold, but it's absolutely necessary. Obviously, we know that the decisions that we are making are placing a burden on people. I want to assure members of the hospitality industry that I personally, as well as members of my team, have been in constant conversation with your leadership. We want to mitigate the long-term effects these public health closures have on you and your workers. I want to thank Sam Toya for his thoughtful leadership. We must stay in dialogue and think creatively about how we can help you and your workers mitigate this storm. I think and I hope people recognize and understand these decisions are being made for the long-term well-being and health of everybody. Simply put, we need to do everything we can to contain the spread of COVID-19. If we were to delay the inevitable, we would be putting more people's health in jeopardy. In the days ahead, we'll be working to communicate with city businesses. We will ensure they all have the guidance and resources they need. Our restaurants and bars need to comply with this guidance because we will enforce this at the city level. And let me specifically address St. Patrick's Day. Now, I am very well aware of the storied traditions of this city on that day. I came to this great city for the first time on St. Patrick's Day as a college freshman, so I get it. But this year, this time, is different. It must be different to save lives. I do not want to see hordes of people out in the streets. The bars will be shut, so please stay home and be safe. I ask everyone to continue practicing common sense measures that have proven to limit exposure to this virus. Continue to wash your hands routinely. Practice social distancing. Stay home if you are sick or if you don't need to be out and about. Not just for your own well-being, but for well-being of every single person you interact with. Last week, the city implemented temporary workplace policies to protect health and safety of our employees and to preserve their hard-earned sick time. The City of Chicago continues to meet daily to review our plans to ensure continuity of government in the coming weeks. We want our employees to know that they will not miss a paycheck. In addition to developing telework and flexible leave policies, city leadership has been working closely with the Office of Emergency Management and Communications to identify critical services that must continue in the weeks coming ahead, including basic services like emergency response, garbage collection, and water, while prioritizing the safety of our entire workforce. We continue to encourage Chicago employers to continue being compassionate with their workers, particularly as we face mandated school closures. Now, of critical importance are our healthcare workers. They are always important, and now more than ever. The doctors and nurses, but also the aides, the orderlies, the cooks, the janitors, the phlebotomists, everyone up and down the healthcare chain are being called upon to stand tall in these extraordinary times. They have been heroic, and as a community, we need to see them and support them in every way that we can. Again, new health guidance and operational changes are impacting us at every level. But we have to be in this together. We have to be united. It is vital that each of us remains flexible, patient, and that we continue to take good care of not only ourselves, but our neighbors as we work to combat the spread of COVID-19. This is one of the most challenging times that any of us will face. Make no mistake about it. But we can get through this. We can protect people. We can save lives if we work hand and glove together and if we use common sense. Now it's my pleasure to call President Toia to the podium.
Thank you, Mayor. Again, my name is Sam Toia. I'm President and CEO of the Illinois Restaurant Association. Public safety is the #1 concern of the Illinois Restaurant Association. The IRA is working around the clock with local, state, and federal officials, such as Governor Pritzker and his team and Mayor Lightfoot and her team, to help employees and employers address concerns around temporary 2-week shutdown caused by the COVID-19. We were informed by the governor this afternoon that this temporary shutdown was necessary to mitigate the spread of the virus, as we saw over close to 400 people died last night in Italy. First and foremost, we want to protect the health of our customers and our team members. That is the #1 concern of the restaurant industry, safety and health of our customers and team members. We remain vigilant, helping employers to navigate the immediate challenges that come with rapidly changing situation. The IRA will continue to advocate on behalf of economic relief for our employees and our small business. It is #1 concern of a restaurateur to make sure his team member, his or her team member, get their paycheck. That is very, very important. It's all about public and safety. And again, I want to thank Governor Pritzker and his team and Mayor Lightfoot and her team for leading us. Leaders lead, and they're leading. Thank you.
Now I'd like to call Dr. Ezike to the podium to talk about the latest on COVID-19.
Thank you, Governor, and thank you to all the leaders who stand behind me. Again, my name is Ngozi Ezike. I'm the Director of the Illinois Department of Public Health, and I want to share with you the latest goings-on regarding our COVID-19 situation here in Illinois. We now have 93 confirmed cases in 13 counties across Illinois. The new counties today include Champaign, Clinton, Sangamon, Winnebago, and Whiteside counties. The number of positive test results that we're getting each day is increasing exponentially, and the number of counties across Illinois is also expanding. People should assume that this novel coronavirus is in their communities, and we all need to take steps to protect ourselves and reduce the spread. There's evidence that transmission of the virus often occurs when symptoms first start, so it's important to limit close contact with people as much as possible, even if you don't feel that sick. We're still learning about this COVID-19. The illnesses have ranged from very mild illness, including some who say they had no symptoms, to severe, including illness resulting in death. Information so far suggests that most COVID-19 illness is mild. However, older people and people of all ages who have severe chronic medical conditions, heart disease, lung disease, diabetes, liver problems, these populations seem to be at higher risk of developing serious illness. It is crucial that we limit contact with older people and those with certain health conditions, which is why there are visitor restrictions at long-term care facilities, and that's why we're limiting gatherings with seniors to no more than 10 people. However, even as a healthy person, you can get the virus. This virus does not discriminate. It is an equal opportunity virus that can affect anyone of any age, of any race, from any zip code. It is important that we reduce the amount of virus circulating in the community, and this happens by reducing the number of people who come in contact with the virus. Bottom line, stay home as much as possible. If you do have to go out, please practice good health actions. Keep 6 feet between the person you're talking with. Make sure to wash your hands properly and frequently. You've heard the 20-second rule. Clean, frequently touch surfaces often. Sneeze or cough into a tissue, and then, of course, properly discard the tissue. And use hand sanitizer with at least 60% alcohol. These are all things we all must do. It is these steps that will make the biggest difference. And now I will give a summary for our Spanish-speaking audience. Buenos tardes. Me llamo Ngozi Ezike. Yo soy la directora del Departamento de Salud Pública en Illinois. Hoy estamos anunciando que hay 93 casos confirmados de COVID-19 en 13 condados de Illinois. Los nuevos condados con casos incluyen Champaign, Clinton, Sangamon, Winnebago y Whiteside. El número de casos que recibimos cada día sube más alto y el número de condados en Illinois sigue creciendo. Las personas deben suponer que COVID-19 está en sus comunidades y deben tomar medidas para protegerse y reducir la transmisión. Es importante que reduzcamos la cantidad del virus que circula en la comunidad. Esto sucede cuando reducimos la cantidad de personas que vienen en contacto con el virus. En pocas palabras, quédese en casa cuando sea posible. Si tiene que salir, practique acciones de buena salud. Trate de mantener 6 pies entre la persona con quien está hablando. Asegúrese que lavarse las manos correctamente y con frecuencia. Limpie los lugares frecuentemente tocados y estornudo o tosa en un pañuelo y luego lávese las manos o use desinfectante para manos con al menos de 60% alcohol. Estas son precauciones que todos debemos hacer. Con estos pasos vamos a hacer una diferencia y puede estar una diferencia entre vida y muerte. Muchísimas gracias. Y with that, I would like to turn it over to Director Tate Nadeau.
Thank you, Dr. Nzike. Emergency management at all levels are working hand in hand with our state and local health officials as the situation evolves. Illinois Emergency Management is providing guidance, resources, and technical assistance at every turn. This health crisis is like nothing that we've ever seen before. As the virus spreads, I want every local community leader to know that IEMA stands ready to help them navigate this national emergency. We are working closely with the Illinois Department of Public Health to prioritize resources and requests for personal protective equipment. The state of Illinois will never put its public or its front responders in the line of danger. We have engaged our business emergency operations center and our private sector partners to identify and address gaps. Behind the scenes, we are using a whole of community approach to build capacity in our healthcare settings. We are working with the healthcare coalitions to identify available resources should they be needed. And by identifying the availability of retired healthcare workers, our qualified staff, we will be better poised to respond to this evolving health crisis. All healthcare workers are doing a tremendous job in what can only be described as uncharted territory. We are grateful for their work and their dedication. As the governor stated, our elections will go on and is scheduled on Tuesday. We have reached out to our local elected officials through the state to ensure that they have guidance they need to protect our voters. We have identified and shared best practices with the State Board of Election and our county clerks to ensure every Illinois resident can exercise their constitutional right on Tuesday. Some of these recommendations include social distancing at the poll places, Based on current forecast projections, it appears the Election Day forecast will allow voters to wait outside during peak hours. By waiting outside instead of inside, we reduce the exposure to the virus. These are practical ideas that can be implemented to safeguard our polling places. And remember, early voting is strongly recommended and encouraged for today and tomorrow. I also want you to know that the Illinois Emergency Management has reviewed the language distributed in the White House and the Federal Emergency Management's announcement for a national emergency. We have identified avenues and financial assistance available to state and local governments to reimburse for emergency protective measures. We are also working with the U.S. Business Administration to make available long-term, low-interest loans to business owners in Illinois who have been directly or indirectly affected by COVID-19. We are reaching out to our counties right now to determine the economic impact of this pandemic to ensure that our businesses throughout the state have the financial resources they need. Sir, at this time, I'd like to turn the podium back to you.
Thank you, General. We're happy to take any questions you may have.
Have you been in contact with governors from neighboring states about what measures they're taking?
Indeed. One of the benefits of being governor is you're a member of the National Governors Association, and through the National Governors Association, I've really got to know most of the governors across the nation. So I've been in contact with quite a number, and they've reached out to us as we've made decisions that maybe have been ahead of them, or they've made decisions that are a little ahead of us. And I've gotten good advice from many of them. I mean, we looked at what happened in Washington State, for example, with the nursing home, and we reached out to the governor. I reached out to the governor of Washington, and then our health department officials reached out to their health department officials, and we learned what mistakes may have been made or what changes they made to their procedures or policies as a result of what they learned, and we tried to adopt those before anything here happened like what happened there. So I've been very fortunate to have the advice and counsel of other governors and been able to give it to them as well.
As far as the election goes on Tuesday, why not extend mail-in ballot, the rules for that, extend it if people don't feel comfortable going in public? And how are you going to be protecting election judges? A lot of people who volunteer to do that are in the at-risk population, older retired people.
So let me answer broadly across the state, and the mayor has been in contact, as have we, with the city of Chicago, with the Board of Elections here in Chicago. Number one, we, as you know, Thursday was the last day that you could turn in an application for a mail ballot. If we had extended that deadline, it wouldn't have guaranteed to people that their ballot would have actually been returned or postmarked as of Tuesday. And that's when it has to be postmarked by law. So what we did instead was allow people to pick up those mail ballots, those applications, and the actual mail ballots themselves, and mail them back in over the weekend so that they would be postmarked by Tuesday. We also implored all of the county clerks across the State Board of Elections, the City Board of Elections, to extend the hours of early voting, so that people who might not have been able to get a ballot by mail will be able to show up in person during a day when maybe they didn't want to show up on Tuesday. They'd like to do it early when there may be a smaller number of people at the polling place.
And are there any changes in polling locations as of, I know that some were moved out of veterans' homes and places like that. Are there any other?
Across the state, I'm going to let the mayor answer all of your questions, but across the state, we did move a few of them. You heard about the one in Quincy that we moved out of the Quincy Veterans Home. With the county clerk, I mean, it was really there. I have to say, our county clerks really have been very responsive to the need here, and the county clerk in Adams County did the right thing and moved that polling place out.
Well, as the governor said, obviously with the election going forward on Tuesday, we've been very proactive in making sure that we're taking measures here in the city of Chicago in concert with our Board of Elections. So we've done a number of things. My team has really been working to be a backstop to the Board of Elections really over the course of the last week, and we've got a team of folks that will be available on Election Day to kind of be a little bit of a strike force in the event that we need to go out to particular polling places or otherwise provide support to troubleshoot. What we haven't done also is we've called through every single polling place to make sure that they're comfortable going forward. Some places, for example, we've had a number of polling places traditionally in seniors' homes. We've moved some of those, and we've found alternative places to make sure that are close by. We'll be putting signage on the original polling place because invariably people will show up there, direct them where to go. We've also done a call for volunteers, and the governor and his team have been great and responsive, as has President Preckwinkle, the county board president. We've got hundreds of additional people who have responded. They're in the course of going through online training, and so we believe that we will have a sufficient number of election judges to staff the polling places on Election Day. I early voted yesterday along with my wife, and I will say that the experience was what I would have expected. Short lines, every single one of the voting machines is wiped down after every single person votes. There's a lot of other heightened cleaning activities that are going on at polling places, so the polling places are safe. But there's still time to early vote. We strongly encourage people to early vote. The lines are limited, and if you do have a mail-in ballot, make sure that you get it postmarked by Tuesday. But no need to wait till Tuesday to vote. Early vote. Places are available all across the city, both today and tomorrow.
Mayor and Governor, can you guys talk about how often you have spoken since Friday? There seems to be a lot of,
I've lost count.
2 hours ago, it was 100 people in the bars. Now everything's closed. There was tension over the schools.
No, there's no tension. The governor and I have been working in partnership. We always do, because there's a lot of things that, of course, the governor's jurisdiction affects the Chicago and vice versa. But we've been in multiple daily. I think we start our calls early in the morning. We check in throughout the course of the day. We're talking at night. Our teams, led by Ann Caparo on the governor's part, my chief of staff, Maurice Clausen, we're in frequent conversation every single day, and we will be until we get to the other side of this crisis. That's what the voters and residents of our state expect, and that's what we're doing.
How many phone calls between your press conference this morning and now?
Probably 3 or 4, easily. Look, the circumstances are evolving, and as you know, I am responsible for the city of Chicago. The governor's responsible for the entire state, and he's got to take into consideration a lot of other factors, as do I. But we are talking to each other, both at the principal level, also at the staff level, to make sure that we are in concert and moving ahead together, and that's what we're doing.
And I'm sorry, I just want to add, and I want to thank the mayor, because we do talk sometimes very early in the morning and then late at night and all throughout the day. She's been, at any time willing to take my calls and I hers. We really do have a good relationship, and things are evolving. As I told you, some of this is science and math. There's an evolution of what we're being told from the CDC and others, and so we're talking through what we know and what we've learned to try to reach a good conclusion for the state of Illinois, for the city of Chicago. But remember, I also talk to mayors all across the state, and I've spoken with, the mayor of Aurora, for example, yesterday, and the mayor of Springfield, and really mayors all across the state, Carbondale and Naperville, and so on. I make calls to mayors all the time, and then we have a group call of mayors across the state. So I just want to be clear that a lot of this is done in consultation. In the end, a decision needs to be made. And each one of us understands how important it is that, that decision gets made. Sometimes there's you have a little bit of a difference of opinion about something, but there's, between the mayor and I, and really the mayors and county board chairman all across the state, and county board president here in Cook County, there's been very little daylight as between the decisions that I've made and the understanding that people have about what we need to do.
Mr. Toya, can we ask you a quick question, Mr. Toya? Places of worship. We're getting word that there were hundreds of people inside New Life Covenant on the south side today, at least here in Chicago. That could have been in part fueled by, I believe it was Cook County State's Attorney Kim Fox had some sort of availability there, or at least advertisement to media that she would be there.
Sure.
Any thoughts about those types of large gatherings? And also, 'tis the season, we have politicians who typically make these visits. And, you know, some would argue that they're not exactly listening to your advice.
I wouldn't say that. I think that the people who are running are listening. What sometimes often happens is that they are showing up somewhere and people just want to be there, and they don't know how many people are going to show up, and so you may expect that there are going to be 150 people that will show up at a service that one of the candidates might go to, and it turns out it's 275, and so it's very hard to police those perfectly. I will say that we've seen a lot of cooperation from folks about keeping the crowd sizes down at church services, at organization meetings, and so on, cancellations of events, and so on. We didn't see that on the streets yesterday with the celebrations around St. Patrick's Day, which was very disappointing. But suffice to say that I really would say that the houses of worship have been very cooperative. Yeah.
Can we hear from Mr. Toya just about in terms of the restaurants and the reaction to this? I know there was a meeting today between 30 to 40 restaurant owners, and there's concern. I heard concern yesterday while the bar crawls.
Again, we're in a crisis, so let's say that. And restaurateurs care about the safety and health of their customers and their team members. With that said, yes, there's concern. You know, I mean, we're concerned not just in the restaurant business, all small business. So I always say communication and education is the key to success, and we're communicating with Governor Pritzker and his team. We're communicating with Mayor Lightfoot and her team. So as long as we're communicating, we will get through this crisis. That's what the governor said. We are a strong bunch here in the state of Illinois and the city of Chicago. So a lot of communication going on.
Governor, should restaurants and bars prepare that this could extend longer than a 2-week period?
Let me just add, I'll answer that question. I just want to add that the mayor separately, I separately have spoken with a number of the restaurant owners, and large and small, and we think we understand fully what the consequences are here for those restaurants and for the people who work at those restaurants. We're trying to mitigate those consequences in partnership with our federal partners. So we're I have to say, I want to give a lot of credit to the Restaurant Association, to Sam Toya, and to the leaders of that association, because they've really been very advisory in this. And as I said about the other companies that I've contacted, I mean, you should all be very proud of the way the business community has reacted here. So far, every call that I've made, people have understood and asked what more can they do. So I'm sorry, your question again, I apologize.
Should bars and restaurants be prepared that this could last longer than 2 weeks?
Look, we're obviously, everything is an evolution. We're making decisions as we go here. We think this is the right period of time for us to make an assessment of, are we having a positive impact here?
Governor, can you tell us a little bit about your call with the Vice President? Did he apologize? What kind of guidance did he give? And does this affect Midway as well?
So yes, it does, and I'll let the mayor talk about the issues at Midway. But my call with the vice president, I mean, I'll just say, with the vice president and with the Secretary of Homeland Security, both came to understand that they had challenges in their own Customs and Border Patrol management of at O'Hare Airport, and I think they both understood and said so that it was mishandled, and they both said we're stepping up today. We're going to be bringing, in fact, doubling the size of the personnel at O'Hare Airport, and I'm sure that the mayor can speak more to that, because I think you were actually at O'Hare earlier.
So I went to O'Hare today to make sure that I could see firsthand what was going on, had a great discussion with Customs and Border Patrol, DHS there. Again, like as the governor said, folks there on the ground acknowledged that there were things that they could have done better to streamline their processes. As I indicated, the DHS agreed to a contract with the city of Chicago through OEMC to allow EMTs from Chicago Fire Department to go to the airport and assist them in the screening efforts. Hopefully those folks are going to be online today. We've got another little hoop that we need to jump through, but we emphasized to them, and I think they understood it, the importance of making sure that that happened. You asked a question about Midway. There's very little international travel out of Midway, very, very small. So really the the show, if you will, is O'Hare and making sure that we get that right. And as I said, the measures that we talked about with Customs and Border Patrol, getting more personnel there, FAA allowing people to remain on the planes until it's their time to get into the queue, I think we'll start to see those measures, if they're implemented as agreed to, really start to ease the congregation of people in the various concourses in the international terminal. But, you know, I meant what I said before. If the federal government actually engages with us proactively, us being mayors, governors, they're going to hear how it is that we can actually operationalize the various directives that are coming from Washington. They're going to hear what our lived experience is and the people on the ground and get our advice on the best way to make sure that these directives can be carried out with the least amount of disruption. But having monologues or no conversation at all isn't helpful. So I think they heard that from us loud and clear, and my expectation is that that will change and there will be better communications on a going forward basis.
I want to just add one more thing. And on those calls that I had this morning, they were incoming calls. I also took the opportunity to express to them our deep concern about the fact that we don't have enough tests in the state of Illinois for COVID-19, and to express our need for even more as we go forward, PPE, the personal protective equipment that's necessary here. We received some from the federal government, but not all that we asked for. And so I pressed the point, and I received yet another call from an assistant secretary at HHS assuring me that they will begin to fulfill the rest of our needs here in the state. So I just wanted you to know I don't waste any opportunity. The fact that I had those 2 incoming calls today, and then actually a third one, gave us an opportunity to press for things that we need from the federal government.
Right,
Thank you.
Who called you last night? Who was the person that called you?
Chris, at 42.25 on Sam, I can have a question for Sam. 42.25.
Only 2?
Tear down, I'll come out. You guys just go get started. What we're gonna do, and I'll get there. Steve.